Right. Hi, everybody. Welcome. We are going to do a digital cafe right now, a little bit different this time. I'm going to put some stuff on a whiteboard and it's just me. I wanted to start, though, with saying, please continue to stay home. I know this is a weekend of a lot of tradition for our faiths, a lot of tradition for families, and it's a hard thing to do, but it is so important that you continue to stay home so we can flatten the curve and see that just doesn't turn into a bigger issue that we have here in Arizona. None of us want that. And so let's all do our part and continue to stay home and connect digitally like we are right now. So thank you for joining me for this live. I wanted to talk today because, like so many, I've been just very, very concerned about really what we need to do policy-wise as we move forward. And there's a lot of conversation that we will see over the coming months about what we've learned during this time and how we can affect those changes policy-wise. But what do we need to do immediately? That's something that I want to talk to you today about. There is a lot of inequity in our healthcare system, and we're seeing that. And as we see what is happening with unemployment in this country, 16 million people now have been unemployed. We really are going to have to make some big changes. So before I get into what I believe should be immediate fixes that we need to ask Congress to do, get on the phones on Monday and start making those calls, and the Trump administration, let's make sure everyone can hear me okay. So let's put a 1 to 10, something in the, just put a 1. Put a 1 in the comments if you can hear me okay, or make sure that we're all connected. If you have questions throughout this, please ask them. We will get those questions as we can. This is a vision, a plan. I'm probably missing things, but it is what I really believe we need to focus on immediately and ask for. So this won't go too long, and so I do want to take questions as well. So let's make sure everyone can hear. Looks like everyone is good. We can hear so far. That's great. So again, what do we do immediately? This is the two things I have been most concerned about as we see our unemployment rates rise. We see the last package is doing things with higher unemployment coming to people, as we see that is continuing to grow. But what about the cost of healthcare? What about people who had employer-based coverage and now that healthcare is gone? I want to clarify some things and talk about what we should do. So if you lost your coverage and you had employer-based coverage, so you lost your job during this time, if you lose your job, that is a qualifying event in terms of the ACA, the health care exchanges. So that means you can go. We don't need anyone to do anything legislatively. You can go and enroll now. There are still problems, though, however, with that, and that's what I want to talk about. So again, please, you have lost your job, you don't know what to do about healthcare, you can go to the marketplace. It is not perfect, but you can get insurance right now, and I want to talk about what else we can do. So two things that I'm concerned about. It's the time and it's the cost of coverage. We're not going to get into the cost of healthcare after you're paying for your coverage in this session. That's a bigger issue to talk about. But the cost of coverage and what do we do right now? So time. Let's talk about this. So if you are on the ACA, if you've ever signed up for it, my family has gone through this process twice, you do not get coverage immediately. You have to wait to the first of the following month. And for different types of reasons, there's different windows. But generally speaking, it's the first of the following month. So if I went to the ACA today, I would start my coverage May 1st. COBRA, same thing. If you've lost your job and your employer, an employer-based coverage, you will have the right to have COBRA. You don't always get your paperwork right away. You are covered for that whole time, but you have to have that back pay. There's this gap of window time where even though they say, yes, you're covered, you have COBRA, and eventually you'll find out about it and start paying for it. If you had that coverage later in the month, if you lost your job later in the month, and all of a sudden you're out of your employer-based coverage, there is still a gap in time where your providers, your prescription drugs, people will say, well, your insurance has been terminated. And that's happened to us where we couldn't get prescription drugs in those windows of time. That's not okay when people are chronically ill, people need their prescriptions, people need things to be done. So let's give an example of that really quick. Because, normally we say employees when you lose your job, you have till the end of the month that you're still on, generally speaking, you're still on employer-based coverage. Sounds great. And then the first of the month, you have the ACA, but so many people fall in the cracks, right? So if you were laid off on, let's say, March 28th, okay, so that means your employer-based coverage would probably end on the 31st. In that 4-day period, do you really feel 3 days? I did the math wrong. I know how to do it. In that period, how many people are going to be ready in this stressful time? How many people are going to miss the opportunity to go in to do the ACA quick enough to know that they can do that? Because, our information, we weakened that marketing around that as well, the Trump administration. So in those 3 days, how many people are left where then suddenly they say on April 4th, they went in and started investigating, figured out the ACA, but guess what? They're not covered now until May 1st, right? That's the problem. So what we need to make sure we are asking for is that those waiting periods are gone, that coverage on the ACA starts immediately. We also, of course, need to make sure that this is not just people that lost their coverage because they lost their job. This is also about people that are already underinsured. There are junk plans now on the market, and also people that never had coverage, because now you don't to make that choice. We're in a gig economy. People can't afford coverage, and so they don't have coverage. So we need to open up the ACA for everyone for that. We need to close these waiting times down and make sure coverage is immediate so people can get the care that they need. We are a chronically ill country outside of what is happening with COVID. And this is extremely concerning. And as we move forward, will be our next healthcare crisis if we don't address this quickly. Now, people can't always afford the plans on the ACA. And the problem is that a lot of those plans, the ones you can afford, the smaller premium amounts, have extremely high deductibles. So we're continuing to put people at risk. So we need to look at what we do with those subsidies and increase subsidies for people to get a plan on the ACA. Other piece of this, that COBRA piece. If you had great coverage through your employer, and it's not about that you love your insurance, but you care about the providers you go to because perhaps you're chronically ill, perhaps they've taken care of you for so many years. Oftentimes, if you go on the ACA, you're going to get a plan where maybe not all your doctors are covered. That is an issue. And so if people are opting right now to say, I need to keep my COBRA because I have to keep those relationships because it's critical to my health, what do we need to do? We need to make sure we have subsidy in this next stimulus package or urgently for COBRA. So subsidies across the board for both to address this cost issue, right? So COBRA subsidies, and I'm not good at writing fast. Now you all know these secrets about me. COBRA subsidies, and then additional subsidies for ACA coverage, because the cost is the issue. The cost is the issue why so many people didn't get on when they now don't have to, right? They're underinsured and uninsured. These are two things that to me are extremely critical. I'm going to take a minute to see how everyone's kind of put a 1 to 10 there, see if there's any questions or comments. I see, hi, Bill, hi, Vardini, Mary. So if there's any, Nell, I see Morgan. Anybody has any questions, definitely let us know. Again, if you lost coverage, you can go, because you lost your job, please go to healthcare.gov and you can sign up for that. You can read about the different qualifying life events. Please do that. Know that we are going to push for more help, because I know, and I'm on the exchanges right now. When you go on there, it is terrifying because the costs are not something that many of us, particularly when we've lost our jobs, can afford. That is why we need to do more. But go on there, see what kind of tax credit you can, see if it's something you can afford. Know that you have that option as we continue to improve. So the other piece of this, I'm going to make sure there's no questions. The other piece of this is really, what are we going to do about surprise billing? There has been some movement that we're seeing that people are talking about trying to maybe tack surprise billing onto the next stimulus package. I think bipartisan, this is something we've been talking about for a long time, but there's been a lot of fights back and forth. We'll see if that happens, but it is something that I will passionately fight for, to end surprise billing. And if it takes this crisis for our country to understand that nobody should, because, what we're seeing is that the Trump administration is covering people that are uninsured in this crisis in terms of COVID-specific treatment. We know testing is free. We know COVID-specific treatment for them is free. We've seen many, many insurance companies, yours, say if that is the treatment you need, you will not be charged for that, and those things are being waived. But what about subsidized billing? Our system has that set up so often it just kind of slips through. So people are, and we've seen this across the country, are getting bills for things that they didn't think they'd get billed for. That either had what could have been a COVID case, they did have a COVID case and they recovered. This could continue to be a problem. And so we need to ensure that we are working through the surprise billing. And I am hopeful that it will happen now, but it is something that will continue to perpetuate if we do not. Imagine somebody that was afraid they had COVID, possibly had symptoms or had it, recovered, a bill, and these can be extremely high, or their family got a bill, and that changes their and anything else, or anything else that happens. It can somebody's perspective on what they should do in critical moments. We have to address these issues. It's critical as we move forward. This is our healthcare crisis. I'm going to take a few questions. Yeah, it is true. So David, you were asking, is it true that Schweikert had voted to remove healthcare? If so, there's a plan to replace. If so, yeah, he has voted repeatedly alongside the GOP, and I don't want to make this a political conversation in that sense, but it is something to be aware of. That the things that we are fighting for now, he is your representative. You need to call to ask for these things, and we need to understand that somebody's track record that set us up to get us to this point, to continue to weaken the ACA, to continue to weaken healthcare in this country, and to threaten pre-existing condition protections. And we cannot have that perpetuate. We need to fix these immediate issues to deal with this crisis, to help people now who have lost their jobs, who have lost their income, and who are afraid for their health. And then we need to also vote these people out in November. That is just the truth of it, because they have set us up to be in this weak position, to not be prepared for this crisis from both the healthcare standpoint and the economic standpoint. Okay, let's see. There's some more questions. Let's just make sure the audio is okay, audio and video, because, in this time when everybody is digital, everyone's doing these, I will say that my internet connection has not been great. It doesn't matter if you're a tech person, your internet connection can go out quite a bit, and ours has had that problem. So please let us know in the comments if you can hear us. Let's do another round of ones, because we might be a little frozen. Okay, that's okay. We will have this. Somebody said that they've watched late, or they've joined late, so they're watching at double speed. This will be up. It's also going to YouTube right now, I believe. So we will be sharing this more, and you can rewatch it. And my handwriting is horrible, I just noticed. Okay, let's see. Joan is asking, through no fault of our own, the federal should require healthcare at no cost to us. What are your thoughts on this? So yes, everybody can probably see that question. Yes, I mean, I think that's when we're saying subsidies to the ACA, subsidies for COBRA. We need to make this essentially for the months of this crisis, if not for longer, at that zero cost. This is our test model, and I hate to say it, to really bring people into a system of single payer and to show how this works. So we need to this point is if people lost their jobs for this reason, meaning they lost their coverage, or people that are gig workers that are out there on the front lines serving all of us, protecting us all so we can stay home, right? And they don't have coverage. We need to be providing that coverage for those people. That is our reason for having government, is to protect people in times of crisis. So I definitely think that that's true. And so that's why I'm saying, let's push for what we call subsidies. Let's hope we get those to a $0 amount. And obviously, if we have to look at income and make progressive that way, okay, because it might be harder to get to zero, but that should be the vision, and work from there to vision. What are we going to do about surprise billing? Is that a question? So we kind of talked about surprise billing. Like I said, it looks like I've seen that there's some talk about adding that on to a next possible stimulus package, get that through. Now, there's two different viewpoints on what to do about surprise billing, really who takes the onus of that, insurance companies or the provider, where that land, and still up for debate. But I think at the end of the day, it is something where we need to set those rates. And we need to say that if you go to a hospital for something and the anesthesiologist is out of work, or somebody is out of network that works on your case, then we need to make sure that that is a set rate and you cannot be charged for that because you did the right thing by going to network. Again, you want to talk to me about policy for Africa? We shouldn't even have these ideas of these networks, right? But that's a different issue. So, all right, we have another question from David. Security more than a strong military. Number one, yeah. We need to be, security definitely is more than a strong military. It's cybersecurity, something that we invest in enough, and something technology in our government is so far behind. We've seen that with unemployment gone up now 16 million. We've seen some states, New Jersey in particular, coming out and saying, hey, we're running on legacy systems that are on COBOL. And we need COBOL programs. Because guess what? These are legacy systems that are being used in our public sector, but our private sector's moved on with new technologies. And so people aren't being trained in that. To keep us safe as a nation, this is about military. It is about security, but it's cybersecurity. It's being up to date with modern technology and running our systems so that we are not in critical moments where, hey, nobody can help us, nobody can fix us. It's about keeping people healthy. The best way to have a healthy economy is to have people, healthy families, healthy workers. And if we continue to de-incentivize doing the right thing by people in terms of keeping them healthy, we will continue to be a chronic country. It will continue to impact our economy. And I really think there's so much policy we need to look at of how we ended up not being prepared for this time. We can't control this coming here. We couldn't control COVID being here. We could have done a lot better. And I'm not going to talk about today, but we know that there was many mistakes made and many maybe things that were just, let's just say it's not real, right? We need to believe science. We know we have that problem with this administration, but we also need to understand never incentivize wellness and prevention and making sure everybody has the access, the equity within healthcare, and the equity that then brings us to a healthier economy, which could have sustained this in a better way, because we have a benefit deficit workforce because we are moving forward with a modern gig economy, but yet our policy and our legislation has not moved forward with that. And that's what we have to look at. So that was a long answer to your question, David, but I hope it helped. If you are watching on YouTube, I always forget to ask, if you're on YouTube, if you want to put a comment in, just know you're there. You can say #live, put a 1. But that also helps us to help spread this message more because it's going to kind of get the message out there. The algorithms, I hate to say it, but tech algorithms like that. So these are very important messages to me because there has been a lot of talk about how we need Congress and the Trump administration to push to open up the ACA. That is very true. That everything I've talked about here, these dates, with making sure people that are on junk plans or uninsured have the ability to have coverage. But it is also important that people know that if you did your employer-based coverage, go at it now. I don't want people to be confused about that issue. It is so important that you have options at this time. They're not perfect, as you can see, but we need you to have that message as well. So, okay, let me see. We have a question from Kate. What can we do to get out to the vote this November to be a mayor? I don't know why I'm having trouble reading this. I apologize, but you can all see that. Be sure all ballots are counted. So our county recorder and our Secretary of State are doing a wonderful job, have wonderful systems in place and a lot of transparency. And we can send you the link that our county recorder actually shared with us. We did a digital chat with Adrian Fontes recently about transparency, sure they're counted piece. In terms of making sure we're voting mail, a majority of Arizonans that vote currently in at least Maricopa County, not across the state, definitely needs to be higher, but a majority in Maricopa County already do vote by ballot or by mail because of the PEVL program. What we can do as individuals is 2 things. 1, encourage people that we know that are not on the mail-in ballot to go and sign up immediately so they get it. So we can increase numbers ourselves. But 2, and I have been probably one of the louder voices on Twitter about this. We need to urge our governor to make it simply all mail across Arizona. But if that second one doesn't happen, then we need to work on the first one together in our communities and make sure everybody is getting the mail ballot, because it is an option. We should push, again, a governor, you can go to his website and see the contact form, and I encourage people to put in notes in there directly to him about this issue, saying we must move all mail because we have to protect not only our democracy, but our health. And we shouldn't have to choose between the two. And we know that if everyone's here in Arizona peak end of this month in May, it doesn't mean we're out of the woods then, right? I mean, this could come back. There's things that could come back. It could be a second wave. It doesn't mean it'll be as bad, and we're not trying to create fear, but we need to be prepared to just the things that we know we can do now to be preventative. And voting is one of them. To switch to all mail for a state that already has mail programs is not a hard thing to do compared to some other places that we've seen. So please urge you to raise your voice about that. Do that on media, write notes to the governor, talk to your state reps down at the Capitol here. If you're, depending on what legislative district, they're out of session right now, but they can help put the pressure on as well and help you with ideas as well. So I think we can do probably like one or two more questions, but I want to go back to this because I know I went through it very, very fast. So I want to kind of, for people that have come in a little bit later, really what I am saying we need to do is 3 to 4 things. It is, we need to make sure that there no longer is a waiting time on the ACA. We need to make sure that if you purchase a plan because you lost your job, you need to make sure that it's right away, not the first next month. We need to make sure that COBRA is mandated across the board, that people get their information ASAP. We need to work on that to make sure that COBRA coverage happens. We need to have subsidies for COBRA so people with chronic illnesses aren't forced onto plans where they can't see their providers and perhaps at risk, because this is history that we're talking about, medical history. We need to make sure that we get those subsidies for both ACA and COBRA as low to the point where people are paying as little as possible, particularly during this crisis, if we can't go beyond that. Right now, we need to go beyond that, if those of you that follow me and know my healthcare views, but we need to get the political will to do that. During this crisis, we must have political will, and if anyone doesn't, that is a signal to all of us who vote. And then we need to make sure we can let people buy into Medicare now. Some people might need to go to Medicaid, and you need to look at those qualified numbers. There's also CHIP. So if this has devastated your personal family budget in such a way, those are options as well. But if we can let people buy into Medicare immediately, also start to test out this notion, but also give people a lifeline right now. And that is so important. So, and open up the ACA. This is the last and the big piece. Open up the ACA for everyone, not just somebody that lost employer-based coverage. So normally you would have to wait till the end of the year to go and get coverage on the ACA unless you lost your employer-based coverage. We should open that up to everybody right now and say this is open enrollment for everybody, so that if you're a gig worker that didn't have coverage, if you didn't get on coverage, or you have a junk plan that is not going to help your family, then this needs to open up. Okay, so let's see. I thought there was one, I think there was a question. I think you guys are commenting to each other too. So that's it. Okay, so I think we have gotten through most of the questions. I was gonna go for about 30 minutes. Like all of us, our kids are home things, and my kids need lunch soon. So otherwise they're gonna come in here. That would be fine. Oh, there we go. So we'll take a few more questions. Biden has spoken about making healthcare more available, a public option, lowering care age, and perhaps buy-ins. Help with the issue we're speaking today. Yes. And so you might ask this, but yes, it will help with these issues. Not immediately as part of a fix during this time of crisis that our country is in. That's definitely going to help, because it's going to give people another option, a substantially lower cost option than the plans that we currently see on the ACA. I will tell you the plan on the ACA we have before the tax credit was almost the amount of COBRA. And so as a family, and this was, quite recent, a couple of months ago, as family, we looked at the two options, and we really struggled because the COBRA plan gave us the coverage we needed in terms of the prayers that we needed for our chronic illnesses that some of you know our family has undergone, and we need follow-up things for. The AC plan was expensive, and it was a matter of how much tax credit do we qualify, and that, there's a lot we have to go, and we still pay quite a bit of money, but it was something we were able to, and not everyone's going to be able to afford that. And so again, Medicaid an option now on those exchanges as a public option that would make a huge difference for people, and also just bringing down the costs across the board. Any other questions? Okay, so I think I might be frozen right now, is what I'm hearing. If I am, I apologize. Hopefully you can hear me and I'm not being a very funny face if I'm frozen. If I'm frozen, give me a 5. Let's change up the number if I'm frozen. Can you put a 5 in the comments? What? Okay, and a 1 if I'm good for you. And we have some people putting links in the chat as well. So if you need to know about voting by mail, which has been asked, if you need to know, 4.5. And how am I a 4.5? So I'm slightly frozen, but I get better. Okay, what might be my signal? My Cox internet is telling me, oh, Kevin says we need to probably wrap this up. So let's look at this chat that some of my team has been putting in there if we've been thinking about. I do want to also give one quick locally. A lot of what I'm talking about is federal initiatives, but there's health rising is an initiative, a ballot initiative that would really push some fixes for our healthcare system here locally, both resources for frontline workers. Interesting, they've been working on this long before COVID-19. And they've talked about infection and keeping infection down in hospitals, and also increasing in coverage and making sure surprise billing ends here in Arizona. So I want to give a shout out, and if we can put the link in the comments, because now that we are in this crisis, they cannot get the signature and the same they need to make sure this initiative gets on the ballot. Healthcare Rising, they are running a challenge right now, specifically is asking people to safely, they need 2,000 people to do this. You're in your family, even if you can each get 5 or 3 or, things like that, or encourage your neighbors to do it. So they can still try to push this onto the ballot. HealthRisingAZ.org, and you can see that link up there right now. So, okay, Anita also I'm a lot of you, it sounds like, here at the end. I'm glad we got through a lot of this up front before my internet decided not to agree with us anymore. And, it's also, Debbie has a good point. We need the census. You have not completed the census. It is so important to funding for everything we're talking for. Please make sure that you complete your 2020 census, and you didn't get a code in the mail, or you don't know what it is, you can still go on there and there's a way to complete the sentence. So we will post the full live that we just did with all my crazy writing and explanations, and maybe a little bit more of a detailed post about what I see that we need to do and what we need to ask for. We'll post that over the coming days. Please have a very safe holiday tomorrow. If you celebrate, again, please stay home. We know that this is a time of really family generally and tradition. The best thing you can do for your family and for all our families is to stay home and connect via Zoom, via WebEx, via Facebook, whatever it is you like. Thank you all for watching, and go eat your lunch if you haven't, and we'll talk soon. Take care of yourselves.